We're the Louisiana Association of Health Plans, and our job is to represent the health plans of the state of Louisiana. And of course, what they're interested in mostly is ensuring that people have continued access to affordable, quality care. And so we work mostly in the legislative and regulatory arenas, but we also conduct educational conferences like the one today. Today is totally dedicated to healthcare reform on both the state and federal level. Obviously, we're talking a lot about the Affordable Care Act, which was enacted by Congress last year, and that we've been rolling out, provision after provision. The most significant provisions of it are still to come, and so we're talking about the opportunities and also the concerns that come with those provisions. This is the third consecutive year that we have devoted the entire annual conference to healthcare reform, and I'm sure everybody knows the appropriateness of that. Well, it's a little different every year. This time, we're certainly aware that health plan leaders have been busy over the past year directing the implementation of the initial provisions of the Patient Protection and Affordable Care Act. And I believe the plans have done a truly remarkable job of implementing those first provisions with the least amount of disruption to their members and the least amount of cost impact. But the biggest challenges still lie ahead. So in the political arena, there's still a lot of talk of possible repeal of the act by the next Congress. There's a lot of talk about perhaps an overturn by the Supreme Court. But in the meantime, health plans are being responsible about it, and they are diligently working on preparing for the most significant changes still to come because of the Affordable Care Act. These are uncharted waters for everybody, no matter what your role in the healthcare system. But we're especially appreciative today that we have such a distinguished faculty of experts on healthcare reform that will help us sort it all out. So we're going to begin with a close look at the ACA, particularly keen on those issues that are current issues and the ones that are still to come in the next couple of years. And then after that, we'll get into some quality issues and opportunities. And then we're going to end the day with a discussion of the changes in the healthcare system right here at home that are the most significant changes of all. So to start that, we've have somebody from America's Health Insurance Plans to give us the overview. LAHP values its long-standing relationship with AHIP. That's the organization in Washington, D.C.
We're in a state of flux and continue to be. There are individuals on both sides of the aisle who have different opinions of whether or not the Affordable Care Act has made positive movement for the industry and for the system, and there are some who think that we are moving backwards. So it'll be interesting to see what happens in the next couple of years as more of the reforms come online and as we move towards that 2014 reformed environment with exchanges and guarantee issue.
A health benefit exchange is supposed to be a marketplace where individuals can purchase health insurance in a competitive marketplace, much like Expedia or Travelocity.
And what's DHH's role in that?
DHH, had we have decided to do a state-based exchange, DHH would have been the lead in developing that. Since we're deferring to the federal government, we'll be the lead on the interaction between the federal government and the Medicaid program and other programs that will have to link to the federal exchange.
The Patient Protection Act required the federal government to develop a set of standard benefits that every insurance carrier in the nation will have to adhere to come 2014. That essential benefits package is in development right now, and it's going to really change the way that we sell insurance. And so we're all waiting with bated breath for the Fed to speak and tell us what it's going to look like. But we are starting to get some clues and hints as to what it will be, and so I'm going to talk about that today.
Any indication of what this is going to mean for the average patient?
Well, the average patient is going to find that once this is done, more standardization from state to state as to exactly what their health insurance will cover. Right now there's enormous variation. All 50 states have different definitions of health insurance, and this standard will impose a sort of federal definition of health insurance on all 50 states.
What part of the Wisconsin plan could benefit other states such as Louisiana?
I think the integration of health systems, hospital organizations, physician groups, multi-specialty group practices who have either formal integration through corporate models or informal integration through financial arrangements is a model that has broad applicability across the country. And I think it shows in part in the results that you see when agencies such as the Agency for Healthcare Research and Quality publish their annual quality report. Wisconsin typically rates either 1 or number 2 overall in terms of its quality performance.
The message here today is these are significant challenges ahead for everyone, payers, consumers, providers, employers. And but the thing is, there are tools and initiatives out there that are there to help. And the forum is focusing on that. We focus on improvements associated with certification as a patient-centered medical home, help providers achieve that, which is part of what is happening at the federal level, a requirement for the federal level. It's coming down at the state. We also are the state designated entity for implementing and operating the Louisiana State Health Information Exchange, again providing critical information to providers at the source of treatment. We also are the Regional Extension Center through our Light Resource Center to help providers implement EHRs so that they can capture data electronically and then exchange it with other providers across the continuum of care.
Louisiana is doing terrific things, both in trying to establish a statewide health information system, but also their work on quality, their work to get providers to work together. You know, that's where we have to go. Quality, efficiency will improve care for patients as well as reduce costs.
I've been very passionate about moving our health outcomes as a state. As you know, we're 49th in the nation, and this is in contrast with being best in the world in music and sports, in cooking, and we're not that way in our health. And maybe part of it is because our cooking and food is so good. But this is our chance, by changing the system, to change our health outcomes. Too often we don't do enough follow-up care. We're not adherent with our medications. We don't have disease management for those that have chronic diseases. The reforms that I talked about today are exactly designed to improve our health outcomes, and that's what we're in the midst of doing right now. We know, whether it's childhood obesity or birth outcomes, that we need to intervene and work with those that are having problems to be able to improve their health outcomes by working together.
We'd like everyone to know that Louisiana's health plans, while they're aware that there are moves in Congress and perhaps in the courts to change the requirements of the Healthcare Reform Act, that the health plans are moving forward to implement the provisions of the law of the land in such a way that it will cause the least disruption to the health plan members, and then also have the least impact as possible on their costs.
If people have questions or like more information, what should they do?
The best thing to do would be to go to our website, which is www.lahp.net.